and welcome to the interview series. I am Prakriti. In the previous interviews, I have asked the teachers what are the differences when one practices in a corporate setup, in a government setup, or in a semi-private academic setup like ours. Today, I have the privilege of interviewing my teacher, Dr. Niharika Gill, who has practiced medicine and specifically rheumatology in all three setups and has seen a wide spectrum of patients, the best and worst of all. She also has an unmatched passion for teaching and medicine. Her straightforward approach often makes her a formidable professor, but she is also one of the most loved, revered, and remembered teachers of this college. Thank you, ma'am, for doing this interview.
Good morning, everybody. Thank you for inviting me here for an honest tete-a-tete. See, basically, I come from a very conservative UPI family. They are only, the vision in their life, either you become engineers or lawyers. And the daughters of the house should be taught well, and then she marries in a good family and settles down. So that is how a conservative UPI family thinks. But my father was a little different. He was an engineer and he had been in different states of India, like being in Bihar, Assam, West Bengal, Delhi. And so one fine day he decided there's too much of changing jobs and getting transfers, and the children were having a lot of problem in settling down to the languages. My dad decided that enough is enough, let's go back to Bombay. And Bombay was that time the hub of university. And we were staying in Cuff Parade those days. So what used to happen that we used to fall sick. So my dad used to take me to a Parsi gentleman. A Parsi, I can still remember that Parsi Baba. He must be around 100 years old now. A soft, little cuddly man sitting, and we used to go to him, "Uncle, my tummy is hurting," like this. And he used to be so soft and caring. And then one fine day I said, I want to become a doctor like him. And that was my little seed in my mind. That was only 8th standard. Then I passed my 10th. Then obviously I was, from a different state, and I was not domiciled from Maharashtra.
Yes.
So the question was always whether I will get my admissions in BMC. So just to be on the safer side, I did my 11th and 12th from Xavier's, and I took up microbiology. So that's just a safekeeping, that if nothing works, I still have something for my education. And so I started. So there was a small little clause in those days. I'm talking about in 80s, 1980. There's a clause that if you have done your 10th and 12th from Pune University, then those children who are not a domicile of Maharashtra but from India can be selected. And luckily, I got into medicine. And then at that time, I think the first the college was KM. Everybody wanted KM hospital those days. And I think so I just missed by one decimal, Like someone got 98.6, I got 98.5, and I missed it. So that's how I landed in Nair Hospital. Nair was like a independence. You're coming from a girls' school. Then 11th and 12th, my dad used to pick me up and drop me back in Xavier's, and people looking at you. My God, in a college and a father picks you up. So that was again, a freedom. I said, Dad, stop picking me up. I don't like it. So that's how the freedom comes from a conservative, then telling Dad not to come to Xavier's. I will come on my own. Then finding my independence in Nair Hospital. My dad is to tell my driver is to drop me every day to Bombay Churchgate Station and Churchgate to Nair Hospital. And one day he said, "Baby, you have grown up now. Why can't you go by train?" The way he said, my driver, "Why can't you go by train?" I said, "I don't know how to travel." He said, "Okay, I'll show you how to read the platform." And that's how my first wings of going from a very, very protective shield of a father picking up and a driver dropping you, and then you taking your first step of traveling alone. And that was one of the Parsi doctor, that will see the little independence coming to Nair Hospital. And with UG, every time you do a post-it, whether it's a gynec or a medicine or something, you start loving that subject. So my first posting was in gynec, how we divide, your batches A, B, C. So my first was gynec. I love gynec. Oh my God, I said I'll become a gynecologist as a UG. Then I came that it's surgery. I started loving surgery. I want to become a surgeon. The third posting was medicine. Not very keen. Then I realized that I had a little liking for the surgical choices in my life. So full internship, I did gynec and surgery. And something changed me completely in gynec. The smell of the liquor, the cats roaming in the gynec wards, and the patient screaming and screeching, and the nurse and the doctor, push, push, push. And that sight, like that time was very theory. We were just theory, the baby born and comes out of this and we'll do that and all that. But oh my God, when you started your internship at Calgary and that screaming, screeching, and that was too much. And that episode to me that we had to do, one after, and I don't know, I can't, I just, I was wondering how did I like that subject, and now I can't even stand there and do that. And those days, I think so, we were also very rude to the interns, the students, and even the residents. It was literally very, very rude to the mother. क्या चीखती है तुम? चलो push करो, नहीं तो बच्चा अंदर ही रह जाएगा. And some of the staff and the mouse used to even give them a little spank on their bums also. Push, And then I said, oh my God, this is what I'm going to do it later in life. I said, no. It's not my cup of tea. Then I said, no, I'll do surgery. And then how was I loving surgery? And we used to be in the wards, in the emergency. I used to stay the whole night. And you won't believe I had learned every suturing types. The one with a long needle, one with a curved needle, and then even learned the knots. And then I started doing all the INDs, the sebaceous cyst removal, oroplasty, and because then when the registrar and the houseman saw that she enjoys it and she's waiting the whole night. So they said, okay, we'll give you now the opening the first layer of the abdomen, closing it. So that was my love for surgery. And I had decided in my life that I'll become a surgeon. So I never really read medicine at all. That was like, passing, okay, I just have to read to pass. And surgery, I'd finished reading McGregor, I'd finished reading the textbook, I forgot, I'm aging. Bailey and Love. Bailey and Love is little one more ahead, one more step. I don't know, and I'm forgetting, it's almost 40 years now. So I'm forgetting names. So I've done that. And then the final results came out. I did equally well in medicine and surgery. And those days, we didn't have NEET, we didn't have any pressure, We only knew that whichever subject you wanted, you put your full love, affection, full goal-oriented and start studying that subject only because you knew the marks will give you that subject. And you will always remain in the same hospital. So the time came, I did very well. The last moment when we write on the dotted line, your first choice, second choice, third choice. So I was just writing surgery, and second choice was medicine. So all my classmates who were boys wanted general surgery. So all of them surrounded me, like how you were surrounding me and sitting and listening to me, they surrounded me. It was 1984. They said, Niharika, not a single patient will come to you. Possibly they demoralized me, demotivated me, made me feel that you're useless, no one will come to a woman doctor. Because ladies didn't make a doctor, surgeon those days in 80s. You can count on your fingertips, few lady doctors, hardly any lady doctor. It was a male-dominated world those days. So they said patients will not come. You know what you will become later? Can you see yourself 10 years down the line? You'll be sitting here and you'll be just examining little lump, lymph node. And what you will gain? Nothing. So why don't you take medicine? They had demotivated me so nicely that I just switched. from, I did medicine first, surgery second. And after that, they said, best of luck, and they all walked away. All my classmates were all boys, and not a single girl. But one girl was very, very strong. I remember her, Neelam Desai. They said, Niharika, don't allow these boys to change your mind. Stick to your, choice. I said, no. They've opened the pages, and I don't want to be just sitting and having depression later in my life. And that's how I wrote medicine. Then came the medicine. And you won't believe that I never studied medicine. I should say I was privileged. God had been very kind. I thank all my boyfriends who are surgeons now that they made me a physician, because the teacher who held my hands, who taught me everything, I can tell you there's not a teacher like him God has ever made in state of Maharashtra. Dr. V.R. Joshi. And very fondly we call him V.R.J. Sir. He must be now more than 80. And still he's enthused at this age to learn. Just last Sunday, I was a convener for a new drug used in rheumatology known as tacrolimus in field of rheumatology, which is basically used in kidney transplant. And Sir is 81 now. He said, I want to listen. I will come. He came in the night at 8 o'clock. So these are the type of teachers we had. And I really owe everything what I'm today is because of my teachers. Now this is how I landed from a UG to a PG to become the physician. And he was the one who groomed me so beautifully. And he made me start loving the subject. And the first thing he said, talking, connecting with the patient relieves the pain more than giving a painkiller. So start feeling attached to the patient, and then you realize your medicines will work very fast. And he told us the concept of looking in as a patient as a whole. Don't divide his organ wise. Don't see the patient as an organ wise. See him as a complete person, so that you are understanding his mental level, his pain, his social problem, his financial problem, and his spiritual also. Why spiritual? Because some people feel that there are two ends of patients, that spiritual means, they'll tell me, aapne thodi kuch kiya, ye to Bhagwan ne kiya. Means that is spiritual, that he thinks whatever he has done. So I always feel, I just tell them, yes, who's looking up from up? It's the God. So God has sent us to heal you. So and then everything else. So he also feels that I have listened to his spiritual thought. So and then what we are doing, we are connecting the four domains and putting it completely for the healing the patient. So that's my journey from a girl from St. Anne's to a college to St. Xavier's girl, then going to undergraduate to Nair, then becoming a postgraduate to a Nair. Then comes, after you finish your postgraduate, comes your marriage for any girl. Now, so coming from a conservative back, I really broke all the boundaries. I married somebody who's himself not, coming from a love marriage. Mother-in-law is a Konkanas Brahmin. So you see what ideas they have. And my father-in-law is a Sir, he's a Sardar from Gurdaspur, and me from UP, born in Gorakhpur. Now everybody knows Gorakhpur after the BJP government, and who's the chief minister of Gorakhpur. So I was born, and that when people didn't even know that Gorakhpur existed. Where is Gorakhpur of yours? I said, yeah, it's in UP. I was just born there because my uncle was the police commissioner there, so I was born there. So see, and then marrying in a family with 3 different directions. We never matched in anything. Sense of clothing, sense of culture, sense of food, all three different, and different religion. We all are Hindus, but one is Sikhism, one is this. My mother is a Shiv Bhakt. They are Ganpati Bhakt. So what did I produce in the end? A cocktail. So what happens? In a cocktail is like anyone how we have a fruit punch. Can you get a flavor of an orange or a peach or a pomegranate in that fruit punch? My child is just a fruit punch. I call him a fruit punch. So that was my marriage. And settling in such a type of a marriage. No one really believes you, no one asks you. There's always a heated discussion for everything. So now, like, my husband passed away 10 years back with lymphoma. My father-in-law's passed away. My mother-in-law has developed dementia. So now I'm like, a lady who lives her life on her own terms, and no one can tie me down at the personal level, at the professional level. So now what made me become a rheumatologist? Now the story begins like this. After passing my post-graduation, then came the DM. Again, those days we didn't have NEET. You get good marks, you get your UG, you get your PG, you get your DM. So now that's what I wanted after doing my PG, neurology. I love neurology. I've read every book in neurology. If you asked me, textbook of muscles, Walton. Textbook of neurology, Brain. And then your Victor Adams, Walton, Schiffer. And there are, volumes of from 1 to 10 on brain and spine. Then I even read, when does a neurological patient require a surgical intervention? So I read neurosurgery books also. Then I've read the whole neurology and tuberculosis by Dr. Ahuja. I've read everything about neurology because I wanted to become a neurologist. The person who's supposed to be father of neurology in Mumbai, Dr. P.M. Dalal, he's internationally famed neurologist. He just passed away 6 months back. I asked him, sir, I would like to do neurology. He looked at me, oh, so you want to do neurology. So be prepared to spend 5 to 6 years with me. I said, 5 to 6 years, 2 years, and he said 6 years. DM is then in 2 years those days. And he said 6 years. That means, no one can become perfect in neurology in 2 years. So people fail. and you have to give multiple exams. I've seen his history. I think so. No one had passed in first attempt. Majority of them 3 attempts, 4 attempts, 2 attempts. And the only person who passed in first attempt is Dr. B.N. Sawant, my teacher, who is attached to Somaiya Medical College. He's the only one who passed it. So you should understand how dominating and how good Dr. Sawant is. And I said, oh my God, I can't spend 5.5 years of UG, then 3 years of MD, and 6 years. Now add 5.5 plus 3 plus 6. I said, no, I can't fail. And that motivation goes down, as you go on failing. So obviously, I had learned a lot of rheumatology from my teacher, who was the head of department of NAR, and he was in charge of the rheumatology services in Mumbai. And with sir, I had started liking, because rheumatology is something like a multi-system disease. So you have to know everything. The kidney, the eyes, the lungs, the heart, the brain, the spine. So that way, it's just an extension of general medicine. So I said, I will do rheumatology. But those days, I'm talking, I passed in 88. So almost more than 30 years now, post-MD. I entered medicine in 1980. So now it's 2020, it's 40 years. So these are my experiences from my personal front from almost 40 years. Now, what are the things in your life that changes you as a teacher, as a human being, and as a doctor? Because even doctors do fall sick. I'll tell you one thing. First time it happened to me that I was a lecturer. My aunt, she was suffering from CA lungs with meds, talking about the 1990s. So I took her to KM with her CT plates, and then we were sitting inside the radiology department. The houseman, the registrar, the lecturer didn't know me. I'm a doctor too, and I'm from NAM. So they were looking at the CTs, and they're describing that. Oh, what a juicy case! Yeah, I will do. The one houseman is saying, I will do the CT guided biopsy. It's my turn to do a biopsy. The registrar said, okay, I'll give it to you, but under supervision. They're talking, and I'm standing behind, just listening. I'm just listening. I'm listening. And I realized I must have done the same thing when I was a PG. That's how we should talk. It's how we talk. Go and take that case, a great case, a good case, exam case. It's a nice case. But you should look at the emotions of the patient. He's dying. So I just turned around. I just said, excuse me, please. I'm Dr. Gill. I'm a consultant. She's my Masi's. Oh, I'm extremely sorry. I said, go ahead and do the CT guided. I don't mind. Because we also have learned on someone else. We also have learned biopsies and bone biopsy, liver biopsy, kidney biopsy on someone else. Because they could not enter the CT room, we never knew who did it. I'm a doctor, so I could enter the CT room, so I knew who was going to do it. I said, okay. And I'm telling you, these are my words, honestly. I told that houseman, you do it, but if you do not get in first attempt, the registrar does it. Thank you, ma'am. No, I think I have the AP here that time. So that houseman did it, he got it. So see, this is one thing that I realized, that someone's suffering should not be a desert for you. That was one episode of mine that I said, I will not talk like this. Second episode in my life was when I had to go as an emergency patient with an acute abdomen in the EMS of KM. That day also I did not tell I'm a doctor. I just went. It was raining heavily. Bombay was flooded. And I knew only one place where you'll get all postgraduate teachers to open me up. I lecture in anesthesia, I lecture in surgery, lecture in gynec, lecture in medicine, because we all had duties. In a private sector, what happens? I enter the casualty. Who will see me? A resident doctor who will call up the boss. The boss will take his own sweet time to come down. So I said, no, my choice is KM. So I went to KM without telling me I'm Dr. Niharika Gill. Obviously, I was tied down. The catheter was, with the OT. So they put the catheter. So they tie on the railings. And how does the Ayabai and the Maushi do? They just pull you from the bed straight to the bed. I howled with pain. I said, Mausi, you have not opened and you have not untied the catheter. Then I realized how many times we must have done that to our own patients. So now I become very even. Whenever somebody thinks, I said, Mausi, आपने untie तो किया ना? Because I have gone through. So these are my practical experiences as a consultant, as a teacher, and a patient also. So that was my second, coming close to
patience.
No, doctor being patient, not telling anyone that you're a doctor. Then you see how we are handled in the casualty. Then this was my second episode of reality check. Third time, I got a stroke. And then I realized the importance of a support system and importance of your family's away. It is a support system. And I will always tell the person, I would have been a hemiplegic if it was not for Dr. Radha Parma. I walk very fast, if you notice, very fast, I walk. And that day, I was walking very slowly. So she told me, Niharika, how come you're walking so slowly? I said, I don't know. I'm walking very slowly today. And that was the time she said, no. I said, let's go. And I think, I think I'm developing a stroke. She rushed me to Chembur. The closest was Chembur. My classmate was a neurologist, and luckily he was there in Chembur. My other classmate had his Gurmeet MRI center. So I had friends at every place, a neurologist, a radiologist, and my friend Dr. Radhavarman, who left this place as a professor of surgery. And then I realized that 7 days of sleepless nights. Am I going to recover? Will my power from 0 by 5 will become 5 by 5? So now I understand when the patients, when they say they are so stressed out, they are depressed, they're irritated. And I tell my houseman and my registrar, don't be rude to them. These are their anxiety which they are having. They don't know whether they will improve. So that are the three things had been a very, very reality check for me when I went as a patient. Now, this is about my personal journey as a doctor who became a patient, and a close in touch with reality and our hospitals and the doctors who are working. I always feel if they have done it to me, they must be doing it to the patients also. So that means I get a 5-star treatment if doctor was attached in front of me as a pre-suffix to my name. So that again was a eye-opener. So I always wanted, because my teacher was so good, I always wanted to become a full-fledged teacher. Who was interested in teaching, academics, research work, publishing papers, everything, all these 5 things. But in everybody's life, you have a certain goals, but goals never always translate into reality, because you have a pressure of a family, your pressure of earning more for the family, your expenditure goes up. It's very easy to say, like we all of us, like even the parents who's when they're on the other side of the table, oh, the teachers don't teach, oh, the teachers don't put that much effort. Have you ever given a thought in this whole system of finance? The teachers are the most badly paid. Whether you talk about a kindergarten student, teachers, or your school teachers, or college teachers, or professional teachers. And then you realize, see how the society teaches you. Then, the parents will say, oh, my student has not done well. That means the teachers have not taught. Did you ever, as a mother and a father, have you ever sat down with your child and checked on him whether the teacher is teaching and whether he's listening, and whether he goes back home, does he recall what was taught? Which my father did, when I told you my journey. He sat with me, and checked on me, on my English, on my diction, everything. Because the parents are themselves busy climbing the ladder of the corporate world. And we pass a judgment on a teacher, drop of a hat. And why not? Many of the teachers, not many of the parents of the students who have I taught have uttered these words. These are all my experiences. And the person who had uttered these words, I had spoken straight on the dais. Now, I will not take names. I've seen the world very closely. I said, would you send back your daughter as a lecturer to this hospital? Is your answer yes or no? Will you send your daughter to earn a lecturer's salary of 60,000? So there are good points and bad points. Good points are that you have a satisfaction, a job satisfaction, doing, bonding with your patient. You feel a complete teacher. At the same time, the drawback is you are not financially strong. And you know what is the reason of me started my practice 20 years back? First time I started, first day of my practice in Chembur. I didn't have money, so I took a bus. Unfortunately, the patient whom I'd seen was also standing in the same queue with me. He looked at me, he said, "Madam, you don't have a car, you're a doctor." So everybody perceives the doctors have loads of money, doctors are just making money. I just looked at him. I said, "Yeah, I'll buy one. I'll buy one." I just kept quiet. Then my life in Somaiya. Now, after doing, I'm not yet done my DM Rheumatology. It's a training which was done by my teacher, and I was completely groomed in a BMC hospital. So once I passed my MD and I decided I want to become a rheumatologist, so I joined my teacher. I said, "Sir, I would like to work for 1 year." The same mentor, in Hinduja and Teju. I want to see the other world of medicine from BMC. Then he realized in Hinduja, then the types of patients are different. What difference did I find? The pain tolerance was better in a poor patients, because every day the life is painful. For a poor patient, everything is painful. And when you go to a corporate world like Hinduja, they are moneyed, so they cannot tolerate pain. They cannot tolerate the pain of a blood collection. They cannot tolerate the pain of intramuscular injection. They cannot tolerate the pain of subcutaneous injection. And here in BMC, they're standing in a queue. And how you all give us tuck, 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 one, and next. Start doing that in a corporate world, you would last a minute there. So one thing I realized, tolerance to the pain. Then this is all my personal experience. I'm not teaching you. I'm just telling you what I have gained as a knowledge in my 40 years. One was pain. And second thing is when you're a doctor, you're a young doctor. You're struggling, you're trying to learn, you're trying to change your personality because you're so used to giving orders in BMC to the staff, to the maushi, to the ayabai, to the interns, to the students. And there in the private setup, you have to be talking so sweetly as if you're suffering from diabetes. I'm telling you honestly. And they will chew your brains because they think they have paid you your consultation fees. He or she has got the right to answer any stupid questions under this sky. Not like that. So again, you have to change your way of talking. You have to listen to whatever they say. But at the same time, you're young, you're still learning. So, but as you grow old and you have your experience, your knowledge, your expertise, you have seen so many patients, you can change like a chameleon how to answer different types of people, which you cannot do it at a tender age of 20s. So that was the different things when it comes to your corporate life. And why did I join a corporate life? Because I realized with the inflation, and the patient passed a snide remark at me, "You don't have a car." And I said, I have to earn, because a teacher's salary gives you satisfaction, it gives you, giving you award every when you have your what they call it convocation. Everybody claps for Dr. Gill. Everybody whistles for Dr. Gill, and that gives a little what I should say feeling of high without substance abuse. But that cannot relate into your day-to-day living, and that's how my journey with my private practice. But what I did, I didn't want to lose my academic teaching. So wherever I got attachment, I told them categorically, I will not work with you between 9 to 4. I will be only available after 4 or before 9. But I promise you that none of your patients will be, gone without me consulting them. So sometime my morning begins at 7 a.m. because I finish all my morning consults in the wards. And then I come here. So that way what I've done, I have balanced my passion for teaching, for academics, and plus earning a little dessert for myself. And you know what I feel that I have scored over the other consultants is that it gives a lot of confidence when you are teaching. And you are teaching and plus treating a patient, what I'll call it in a financially starved patients. Because you cannot use a battery of tests. You have to come to a conclusion or a diagnosis with little budgeting of his money and investigation. So after 20 years in Somaiya, I still managed to give a diagnosis with my limited investigations and more of my knowledge and experiences and expertise. Now, coming to my journey in rheumatology is what has changed. What happened now, rheumatology in 80s until now in 2020, people feel that it's a domain of an orthopedic surgeon because it's a joint pain. They do not understand that rheumatology is a subspecialty of medicine. It involves each and every organ in the body. And somehow in our curriculum, right during my days also, we were never taught rheumatology in the undergraduate. Even in postgraduates, in our curriculum, in our syllabus, you will not find rheumatology. It is in last 10 years that we started, small chapters on curriculum and undergraduates and postgraduates. You have had approach to musculoskeletal system, you'll have arthritis, you will have like a small little lectures on lupus, vasculitis, gout, rheumatoid arthritis, ankylosing spondylitis, which we never had. Then I became a teacher for physiotherapy also, for them to teach them about the rheumatology part of their syllabus. So it over the period, and I should say in 1990, that the little awareness has come. And once DM came, at least the educated class of people knew what is rheumatology. And the educated class who are well versed, they started asking in the corporate, that do you have a rheumatologist in your hospital? That means we have arrived. We have arrived slowly in last 20 years. Otherwise, I've got arthritis. Who's the orthopedic surgeon on call? Now patients come in the OPD and they ask the OPD manager, do you have a rheumatologist? They said, yeah, we have one. So that has changed in the perception of the society for understanding that there's something which subspecialty of medicine which deals with rheumatic pains. And in 70s and 80s, rheumatism means rheumatic fever. So see, they're so different, but still. And then whenever you don't have a knowledge about any subject, who makes the maximum money? The quacks. And there's a saying in Hindi, Behti Ganga mein haath dho lo. Huh? There's a kahavat, like so who are the people who wash their hands and make lots of money? The Ayurvedics, the Unani medicine, the homeopathy, and don't forget Ayurvedas. That even our Ramdev Baba's medicine, then the oil massage walas, the Kerala massage. Oh my God, they mint money, 25,000. Huh? It's not a small. And if I charge 25,000, the patient will say, the doctor looted me. And that massage person gives 25,000 for the whatever package deal they have, then it's fine. So I feel that we are evolving. And what is the other evolution, I should say, and was, I can talk like how we talk about evolving of a mankind. Same thing, I can say I have evolved as a rheumatologist because I have seen in 40 years journey of rheumatology, investigation, serology, immunofluorescence, research, genetic typing, and the biologics. So all this has happened 1980 to 2020. 80, I started my journey with a bottle of aspirin and a bottle of endomethacin and chloroquine for my arthritis. 1980 was the era when the methotrexate came in the world, so the use of methotrexate. 1985, 87 if I'm not mistaken, 87, leflunomide. And 1990 was the year we changed the therapeutics in rheumatology, the biologics. So what has happened, even the pharma industry, they're looking up at us. Because for a pharma industry, money making is in which department? Cardiology, diabetes, heart attack. Who's going to put their R&D in rheumatology who just have pains? So anyway, they have aspirin, indomethacin, brufen, Compiflam. But this whole thing changed the picture of rheumatology. Because we have unique, and I don't know why, there's a drug company likes to keep names which are really a tongue twister. Infliximab, adalimumab, golimumab, baritinib, tofitinib, and then they have tocilizumab. Very difficult. Why can't they come with a simple thing, Then we have something, so sometimes I can't even pronounce that word, so I just use the trade name because it's easier to, then I say it's interleukin 17 and inhibitor, that is CAFO. I talk like that because sometimes, I find too hard to even pronounce those words. But their entry has changed the life of a rheumatic disease patient. And this is like about the pharma industry and the evolution of drug therapy. And now I'm talking about my satisfaction level. Because the same patient, I have seen her as a lupus, as a rheumatoid arthritis, and angst in the age of 15 onwards. I have been with her throughout her ups and downs, throughout her journey. Like I have patients that I'm practicing for 20 years. I've seen their disease, I've seen their remissions, I've seen them getting married, taking care of their pregnancy, seeing them after the flare of postpartum, then seeing that during the lactation period, and their miseries, when the disease has their flares and remission, and all that stress, will I pass my gene to my progeny? So that, lot of bonding, and you develop a compassion with the patient. But, the other people who doesn't know me well, who see me as a third party, will say, oh my God, this lady is so strict and she's so curt with the patient. But patient knows why I'm curt. And they say, madam, because you were very strict with us, you were very, very harsh with us, you were disciplined, you should not see our file till we have done the test which you would ask for. Why? That was for monitoring their side effects of the drugs. monitoring for the organ involvement of the diseases, planning for their pregnancy, seeing that they do not conceive when they are on tetrageneric drugs like methotrexate and leflunomide. They should not conceive because it is a tetrageneric drug. So all those things, so afterwards they start loving you because they have seen you that I have been with them. And the other thing is, normally I'm not a very WhatsApp type of, I don't like to be disturbed. As a student you have seen me, I'm very, very blunt and curt on my phone. But somebody old calls me and their children are away in US, UK, Australia, and when they have problems, I do listen to them because they are old. They have no one to take them. Now my journey as a PG teacher and a UG teacher. Now you may not like it because I'm not very goody-goody. What I have seen the change in the present generation. I will talk in the both aspects of the UG and a PG. Coming to the undergraduates like you. In 20 years, as a teacher, I started teaching with a chalk. And I used to connect with the student with the eyes. Because I'm writing chalk, looking at you, talking to you, and going. Then after chalk, to blackboard and chalk came your OHP, overhead projection. So you write, it reflects, you write, and you're again reflecting. Now, what do? Now we have come to a stage where we are talking about a structured teaching, a module teaching. No, we are, what I realize, people who are from this era may feel that I'm outdated. The new generation teachers will say, oh, we like our YouTube presentation. We like our giving web talks. Somehow I cannot connect to a wall. Suppose like if you tell me to give a talk and I'm looking at the camera and I'm talking without any students sitting in front of me, I won't be able to give this type of interview. Many corporate world people have asked me, will you give an interview? I said, sorry, I can't. Because what they do, they put you in a closed room, lights on, they do your makeup, and you look more beautiful with all, and the lighting effect, and they'll come and powder you, your hair and everything, the spray, and then they will say, start talking. I can't talk like that. I have to have students in front of mine. And I always feel that teacher is incomplete without a student and a student is incomplete without a teacher. So it is like a symbiosis. Even you may be the best teacher. If you have no students, I'm going to talk to the walls. And then comes your technique. We follow the Western culture in every possible thing, in our dressing sense, in our thought process, our food. We are becoming very westernized. We are even taking their way of teaching. But I would like to ask you people, do they see 600 patients? Have they ever walked in the casualty of a 9 km sign? I put my brother in mind. My brother is a pediatric nephrologist. I asked him in America. He said, what? EMS is like, it's like a protocol to be followed. Okay, unconscious patient, 1, 2, 3, 4, 5, 6. Trauma patient, 1, 2, 3, 4, 5, 6. So there we are, very different type of teaching. Here's a different type. So I always feel balancing is very important. I can't teach as a structured module in small cubicles. I want you to experience the touch, the feel. When you hold a patient, when you touch the patient, when you talk to the patient, you look at his emotions, you look at his pain, then you know how much to press on his abdomen when he's suffering from pain. And if you are talking to a robot, how do you develop those finer qualities? You can't. So, okay, we are also following the globalization, so we should also balance out. I'm not saying it's bad or this is good. We have to find a balance. I suppose I just come here and I just sit here and I put my recording And what I'm teaching you today, I'm saying today, I just put a record and I put the button on and I said, listen, and I sit like this. Would you enjoy the teaching? I don't think so. You will even remember 1% of it. But if I teach the same thing as my experience, as the patient's experience, I think so you'll always recall. What I'm teaching today, I'm recalling what my teacher taught me. So this is, and what has happened, that your whole teaching technique has changed, and your question paper setting has changed. It's more of MCQ. MCQ doesn't test your understanding, the knowledge, tangential thinking, out of the box thinking. It is like checklist. Ankylosing spondylitis, HLA-B27, HLA-B2, HLA-DR3, tick. Like we'll read how many of them is like they're genetically positive, they are 70% positive, 30% negative, but they may be harboring some MHC genes is lacking. All those things comes when you are reading the whole medicine. That is where I find it has changed. So, and the depth of knowledge is lacking in the students. They are so used to that reading the synopsis that they have forgotten what is inside that synopsis. And it's an age of instant knowledge, Instagram, everything that, instant cooking. So we are all 2 minutes Maggi noodles. So what has happened, and the other thing is that what I found, the bonding among classmates are going down, extremely down. You as a student, you even don't know that the batchmate of yours is feeling low, is suffering, she is depressed, she's unhappy. You don't even know that. But we, those days, even that smile was missing, we'll ask our classmate, today you're not smiling, what's wrong with you today? Why aren't you talking? Why you are dressed up so badly today? So because you are down. So that is what I'm missing. See, in the end, when you are sitting as a doctor in a clinic, he is not bothered. The patient doesn't know that you got a gold medal, or you were too good in extracurricular activity, or you have passed from a renowned hospital, or you got your degree by paying seat, or you bought a seat in a private. No, he doesn't know. He sees you as a doctor for whom I have gone for my ailments, and she is the one who's going to listen to me and treat me and make me a happy person again. So what is he seeing in this doctor? Is a wholesome, how we talk wholesome food. This is my experience in 20 years in Somaiya, and I'm not liking it. Because if you ask me, I remember every student of mine from 1997. What they have done, where they have reached their goals, what they're doing, everything. I remember my PGs and everyone. But now it is getting diluted. I don't use the word hate. I'm saying I'm not able to connect. I find dilution in my approach to you all, because I do not get the same response from that side. So this is like my teacher and a student relationship as a UG. Now coming to my postgraduates as a teacher, what was the difference in my days in 80s, 90s, and what is in 2020? I still remember my first day of my postgraduate in a casualty. So my batch people, if I'm doing medicine, someone is doing surgery, someone is doing gynac, someone is doing anesthesia. So we were so protective about each other. Like if I have made an error on my judgment, then the other friends of mine will protect you. If I have to do a CPP cut down, my surgical classmate will do surgical so that I don't get fired. I said, give me a fitness, my boss wants it, my anesthesia resident will write all the notes for anesthesia, and make it like a complete paperwork with a ready-made food packet to be delivered to the seniors. See, the work is done. A pathologist will do my blood test, then only I can tell my boss, no, that the sugars are this, or sodium level is this, potassium is this. My radiologist friend takes out, does an urgent ultrasound for me, so then only I can say, no, sir, there is a gallbladder stone with cholecystitis. So what was it? It was a teamwork. And we were bonding with each other. We bonded. We spoke to each other. We ate together. If somebody is busy in the casualty, has not been able to, go to mess, and the mess is closing time, the other one who has finished her duty will just go and pick up something and feed the classmate with whichever faculty, medicine, surgery. It was not just medicine. It was not surgery. It was your batchmate. This is not there. Like if I had some issues with my colleague, we should go and say, you didn't do this, you did this, you have to do this. It never went as a complaining. Here everybody is complaining now. And what has brought the change? Because we do not walk 2 steps forward and speak to that person. We send messages. Our communication is electronically, because when you write something with electronically, you do not know at what state of mind, what was my perception, what were the words did I say. It's a cold words sent electronically, which was not there during our times. So we did not have so much of friction. Now everyone has friction in a teaching hospital. So our mode of communication is electronic. So tell me, even the sisters call the resident by WhatsApp. Does the sister remember what the mom and the resident or the intern was? What was the name of the intern? She is a person. Her job is, it's like a job to be done, like how we do checklists. When we fill our forms for applying for passport, the checklist, name, domicile, certificate, PAN, checklist. That's what we are turning into. And I'll tell you, after 10 years, you won't have teachers like me, like us, not me, like us, who will tell you that you're wrong and tell you that you're right. And all these years, I've been telling all my students, balance your studies with your extracurricular activity. And I'll tell you honestly, I won't take names again. Many of them have brought lots of laurels to the college. You applauded for him. You put his name. We put flowers. We worshipped him. We clapped him. His photo was in the Somaiya group. But suppose he doesn't study and he doesn't pass. Will that suffix which he has got, the plaques, the laurels, will be added to his marks? So that is why I tell all my students, you have extracurricular affairs that are good. Otherwise, how will you develop different aspects of your nature? At the same time, do not neglect your studies. You'll see for yourself. The results are out. So this is about the PGs. See, research can be done if you have a support system. I'll tell you, I went for listening to somebody, a big man, Robert Fox vascular derma. You know what? His team had 20 people, a team to do one research, and they were just doing research, without any other work of correcting papers of MUHS, correcting physiotherapy papers, correcting prelims, taking lectures, taking PG lectures. No, they were just focused on that research. So you're not worried about your earnings. You are well looked after. So why not? So it's very easy. It sounds very nice, research and this, but you have to have a support system. Who's going to? If I run a rheumat clinic, I have no data keeper to feed the data. Do I speak to the patient 20 minutes each and understanding her complications and her remissions and her relapses and her side effects? Or am I going to fill the data? So, it sounds very nice. What about the research options? A single person cannot. It has to come from the top. It has to come from the ministry. It has to come from the vice chancellor. It has to come from the university. It has to go to a place. First of all, see, if you are increasing the number of students in a college, you have to increase the teachers also, no? Are we increasing the teachers? No. So no, these are the. But in short, I'll say whatever. I may get angry with you people, but I love to come to Somaiya. I love to come, and that makes me a complete teacher and a consultant and a clinician. So that's a journey of my life, and it is like a small storytelling classes, like snippets, and you people are the first one to peep into my personal plus professional life, and I enjoy every day of my life. Medicine and future. I'll tell you, a time will come, medicine will not be run by the doctors. Medicine will be run by the MBAs, the management. The management who does not understand that this is a human body, and human body can take a turn anytime. You may walk in the hospital on your 2 feet, and you may be out in a wheelchair, because when you were walking you were having stroke and evolution, and you did not respond to the treatment, and you go back on a wheelchair. And what has happened in the outside the world, corporate world, they are not bothered about the emotions, how good you are in knowledge, how you have diagnosed the patient, how much money have you made for the hospital. So I do not call them as doctors, I call them MBA. Because if you notice in any of the non-medical corporate world, how is an employee judged? Employee judged by how much sales he or she has made, how much the profit in the financial year the employees have got for the company. So same way, a hospital is not to heal. Hospital is a company. So this is what I am seeing in the your world. But I was lucky in many ways that I've come out from all my illnesses also very nicely. And second is that whichever place I look for attachment, I've been very honest with them. So they have never asked me, how much money did you make for the hospital? I don't know, I was exempted. Because maybe the respect of being a teacher or being a head of department of medicine of a teaching hospital for a very long time. Then I had my PGs who had become a consultant there as a hematologist, neurologist. So maybe that made a little difference to me. So I'm vouching about myself. I vouch for myself that I have not been weighed in money, but others do. So you have to exist in that business of medicine, you have to make money for the hospital. So this is what I'm going to tell you, because now by the time you pass out and you go out, it will be no nursing homes. No nursing home. So you will be more like a corporate. It like exactly the way in America it happened, na? Pink slip, hire and fire. You don't make money. You are hired to make money. You don't make money, fire. Next batch will come. He will also, he makes money, he stays in the corporate hospital. He doesn't make money, fire. So this is not a good sign for your generation, because you will be judged by how much you make money. So if you're pressure of making money, then sometimes in your life there may be error in judgment. So you will end up doing something which is not called for. You know heart of heart that you're not doing the right thing, but you do it for some compulsion. This compulsion can be anything. Okay, so this is one thing I see in your future, the compulsion of doing. At the same time, it's like two swords hanging on you. One to make money, and at the same time, the lawyers are watching you like a hawk. You make one mistake to bring you down. Then come the insurance policy. So because you're so scared, money and the litigation, a lawyer, so the insurance agents are also watching you to catch you. And they give you a dream, they show you a dream. We will protect you with 1 crore, 2 crores. You're a cardiac surgeon and you should insure yourself with 2 crores. Oh, you are a surgeon, so 1 crore. Okay, you are a physician, so 50 lakhs will do for you. No? So what are we? Are we a robot? So your life, by the time you become my age, I'll be dead and gone. So what I'm trying to tell you is that you people will have tough time. Already. So these 3 things, and already the society does not take you nicely. Society doesn't protect you. Tell me, I'm a doctor and you are future doctors. During all those time when the doctors are beaten, they develop skull fractures and they die or something, does anyone of your single relative ever thank you and say you have taken care of me? Just don't go out in the society. See your own family, your joint family and your extended family. Has anyone ever said thank you for being there? Thank you for giving opium without charging? Can you go to a sweet shop and say, I'm hungry, I have bought 1 kg of sweet, can I take 2 chocolates, 2 mithais and eat? But here when the patient comes, he takes consultation of himself, and on the way he'll say, Madam, can you see my daughter? She's 14, she has got a little fever. Can you check? So do we say, pay again, go and pay? So what happens, our humanity, our human nature is also being taken for granted. And what happened, I don't know why the society doesn't want to spend money on doctors. Why go out? Look into your own family. They don't mind spending 20,000 a stay in a 5-star hotel room. when they go to an exotic resort and you just tell, my professional field is that, just look what they will tell you. So I have seen, so what I'm telling you, I have seen both the corporate life and the other thing, what I feel now, don't sell yourself cheap. If you're worth this much, you take your fees. With a Taj, a cup of tea costs 250. You have to pay 250 na, to get that cup of tea. Can you say, for discount दे दो, फिर आज पिला दो, मैं कल आपको आधा पैसा दे के जाएगी. That's how the patient talks. Madam, I don't have money. Take your charges, and rest I will pay later. Can I say, I will not write the prescription? You will do it now. But if you say, I don't have the money, he'll say, come again. You won't be served food here. So somewhere, lots of things have to be changed by. And the other thing, what I've noticed in the doctors, we are our own enemies because we want to climb the ladder fast. So Indians have a very frog mentality. How can you climb up? And again, I'll tell you one thing more. When we are teachers, the teachers say good things. But once you come out in the open world, and they are also clinician, none of the teachers would like you to climb higher than the teacher, because then jealousy comes in, and you're envious. Because again, what is it? So it is almost, we follow what is known as Charles Darwin theory, survival of the fittest. Because teachers remain teachers, but when what happens, the student becomes a competitor. So this is a controlled environment. Here, I'm a teacher and you're my student. So I'm telling you about in your past, future. These also aspects are there. It is not money. It's your other aspect of it also, because we are also fighting for the same type of patients. Now, teacher was alone. Now the students have come as the competitors. In heart of heart, tell me one teacher who's tired, his hands are full, he's exhausted, but he will say, see, I have got my students who are very good, why don't you go to them? Very few. So, but there are teachers, they're good people. I have a teacher who writes on his prescription pad, 1, 2, 3, 4. These are my students. These are the areas of practice. Please contact them. Tell me, how many teachers does this? And again, the quality of your practice, is judged by how many patients are standing outside your clinic. So again, what are we doing? Number game. Like how a corporate world says, what are the sales? Show me the profits. So, I can only say that it's become very complex. And the more you go inside the complexity, you'll get disheartened. You'll get demotivated. So, I don't want to demotivate you. I still love myself to be called a teacher, a clinician, and a doctor. So don't get, because everyone has to struggle. And I can only say one thing, don't get depressed or something if you're not doing well for the beginning, because everybody in the end evens out. Some people have hardship for a longer time, Some people will have hardship for small time. Or some people will have a great support of their parents. Some don't have support from the parents because they have come from a non-medical background. And please do not compare yourself with anyone. You create your own niche. Because I believed in that absolutely. And I never in my life ever compared myself with anyone. I only compare my knowledge-wise. No, that person knows more than me. I have to read more. So I'm not competing with the fringes attached to the knowledge. I'm really looking forward to the knowledge means knowledge. That if this person knows X amount, I should also know that much. If that much advancements have occurred, so I should also go and update myself. I should also go for my CMEs. I should update myself with the professors who are the leader. And one thing more. Some people have a leadership quality. Some people have the gift of gab. Some people have that thing in doing research, basic research. So that doesn't mean a person who's a good researcher is a good clinician. A good clinician may be a bad researcher. A person with the gift of the gab knowledge may not be good, but can hold on to the audience. So each one is different. So what I'm trying to tell you for you as students, motivate yourself by looking into the good qualities of each one. And don't allow anyone to pull you down. Don't allow. Even if it means losing a job. Because if you allow yourself to be trampled by everybody. At home front, personal front, job front, patient front. But at the same time, learn to voice your ideas with respect, with dignity, and balance your professional and personal life. What is a great idea? You may be the world's best doctor and your daughter commits a suicide. Commits a suicide. So what has happened? So you have failed as a parent. But to have a success story of women. So I believe success with home front. And every day is a stress in medical life. Learn to live with. Learn to not live with stress. Remove the stress by enjoying your work. The best part, if you feel you're stressed out, tell the patient, I'm through for today. I can't see any more. You stay close by, come back again. But what happens? You're tired, you're stressed, you take out your irritation on the patient. In your anger, you may make an error in the diagnosis. Wrong diagnosis, wrong treatment. So let go. So you should know when to let go. Thank you for calling me, inviting me. It was a lovely talking to you people. And don't take it as a sermon. This is I'm telling you, it's my personal experiences, what I did, what mistakes I did, what I don't want to do it, and I would like to balance out, and I will not allow anyone to take away my freedom of speech. Okay? Because freedom of speech is very important. And learn to be upright. Learn to be upright. Because the clean name is very, very important the rest of your life. Money can be earned in different ways. Okay? Thank you, dear.